the silent intelligence.
Good evening, and welcome to another event by the Silent Intelligence, Saving Lives with Connected Devices. For those who don't know me, my name is Daniel Obodovski, and I'm the founder of the Silent Intelligence. We've been doing events in San Diego and beyond, bringing people from tech industries and today also from healthcare space to talk about interesting opportunities, interesting use cases, what's coming in terms of technologies, and how actually help facilitate people working together for startups with larger companies, developers, engineers, investors, and so on. So today we're going to have a very exciting event, but before we're going to jump into the panel, I wanted to actually thank those without whom this event would not be possible, our sponsors. And specifically Procopio, who provided this location, provided food and drinks for you guys. Thank you.
And I turned the air conditioner on.
And Molecular Diagnostics with Sylvia. Thank you very much for being our sponsor. And at this point, I just wanted to give our sponsors an opportunity to say a few things and talk a little bit about what they do. Noel, you want to go first? Sure.
Thanks, Daniel. I'm Noel Gillespie. I'm a partner here in the patent group at Procopio. So I'm also the head of our MedTech practice group. And we do a lot in the space, everything from simple devices to very complex diagnostics. I happen to focus on kind of digital health, e-health, wearables, that type of stuff. We're the largest law firm here in San Diego, about 140 lawyers altogether. So we're full service. We do everything. And we've been partnering with Daniel and his meetup for some time, kind of from the beginning. And we're happy to host you here and are excited to hear about some of the Internet of Things and wearables and stuff like that that's coming down the pike. Does that go over there?
Thanks a lot, Noel. Sylvia. Whichever mic you prefer.
Oh, thanks. Hi, I'm Sylvia Norman. I'm the founder of Molecular Diagnostics Consulting. And what we do at Molecular Diagnostics Consulting is we provide services for companies that are developing a wide range of diagnostic products. And you have a flyer on your chairs. You can see we have services that do everything from product concept to product launch. But our sweet spot is working with startups. We're very interested in that, and that's mainly our clients working with startups. And what we do is we go in, we talk to them about the product design. We help them with the product design, like a diagnostic assay or the platform, and then give them a development plan for the quickest, most efficient way to get that product through the R&D process, and then help them actually move forward with that through project management, regulatory guidance, doing document generation, whatever it takes, whatever they need. So I was really excited when Daniel agreed to organize this event because this is a very special, near and dear to my heart topic. I grew up in the Midwest on a farm, and we did not have very good access at that time to good medical health. In fact, we even had trouble keeping good medical providers at the time. So I'm very excited about what digital health can do now to help bring good medical, good medicine to everybody, including remote and low resource environments. So very excited about the event and interested in hearing what the panel has to say. Thank you, Daniel.
Thank you, Sylvia. Thanks. All right. Let's jump straight into it. So when we're putting together the panel and thinking about what can you actually say about when you talk about remote diagnostics and remote diagnostic devices, we put together a panel that would represent various sides of this topic, from ventures and Qualcomm Ventures, and from the investment standpoint, also through UCSD and experience in the medical field, and also from a technology standpoint. So I'm very delighted to introduce our panel, and basically Vicki Smith of Qualcomm has been with Qualcomm for some time and worked with the Qualcomm Life, and recently moved to Qualcomm Ventures. Welcome, Vicki. Tim Mackey with UCSD, and Tim and I actually met a couple of months ago when we met at the Corner Bakery and had a very interesting conversation about all kinds of aspects of diagnostics and healthcare and how technology can help. And it was really great to get Tim's perspective. And Padma and I met, what, about a year ago or so at an IoT conference in San Francisco. And since then, we've been talking regularly about what's happening in the industry, what's happening in IoT specifically, in many different verticals like retail, healthcare, and so on and so on. So, guys, I just wanted to start and basically let you an opportunity to each of you to talk a little bit about yourself and about what you do, and maybe say a little bit what's remote diagnostic for you. What do you see? What does it mean for you? Whoever wants to start.
Go ahead.
Yeah.
I can start. Well, you already did kind of introduce me, but so I've been with Qualcomm for 15 years now in different capacities. Started with Qualcomm Life when at its inception in the end of 2011. And through that process, I actually simultaneously worked on my master's in biomedical engineering. So I have finished that, and I have a life back, so I'm excited about that. So again, very passionate about technology and adding technology into the health space in particular. And exactly what you were just referring to, being able to enable good health care even in remote areas, and that's what you can do through wireless connectivity. So that's what that means to me.
Thanks. My name is Tim Mackey, and I'm an assistant professor at UC San Diego. My primary focus is in global health, but I do a lot of work in e-health, and I have a lot of interest in the industry as well because I worked for industry a long time ago. And the thing for me about remote diagnostics that's really interesting is how do you develop things that are accessible for resource-poor populations and that address issues that are pertinent to resource-poor settings. And that's really interesting because you got to kind of dual scope the design of that device to make it applicable to that population. So those are the things I'm interested in. I'm also interested in the disruptive technologies that are, kind of evolving all over our lives, and figuring out good research questions to kind of tease out what is going on in our society.
So yes, my name is Padma Duvvuri, and I lead the Internet of Things practice at our company GlobalLogic, and we are a software services firm. So we do everything from conceptualization through actually software development and testing, and all the way through support. So it's like the full life cycle of services. And IoT has been interesting for us because we've been working in the technology space and different pieces of it for a long time. So end-to-end embedded, cloud, big data, end-to-end mobile, and IoT was the fabric that actually tied all of these together. And so when I talk about IoT, I really say it's the third wave of technology, and that today we call it IoT, but someday it'll just be the way things are, and it's so exciting. And one of the three areas, as Daniel mentioned, was retail, automotive, and healthcare, just going to be completely transformed. And remote diagnostics, it's interesting, I call wearables kind of the gateway device to really get into this, but it's just the tip of the iceberg in terms of what is possible. And we'll talk more about that, but just in terms of machine learning and how do you add connectivity to intelligence to really enable these devices to help people's lives, really give them healthcare, which I think is an absolute right for everybody. And it's like, how do you bring this to the masses?
Thanks. So I actually wanted to start with Vicki. And it's interesting, you know, a lot of people come to the panels and they come with PowerPoint slide. And Vicki actually came with the specific devices, with real stuff that you can touch and see. So Vicki, can you tell a little bit more about what these devices are and what do they represent?
Well, sure. So these are things that you can actually go out and buy today. So digital health is not just kind of make-believe and just kind of somewhere out there in the future. It is actually here today. I brought a bunch of things here. I can't go through it all right now, but one of them, I'll just kind of walk through a demonstration here, is basically a sample of using a wearable. So I actually have the Qualcomm Talk Watch on. This is kind of a reference pre-Apple Watch, by the way, just letting you know that. And then
great conversation starter, by the way.
Thank you. And then I've got this Fora thermometer. Again, go to Amazon. You could buy it. I'm just going to turn it on and take my temperature here real quick. This actually has a Bluetooth radio in it, and in fact, most of these devices here have some sort of connectivity in them. And essentially, the data will be sent from this device to some sort of a hub, whether it's going to be some kind of an application that's on a smartphone here, or it can actually be something like this, which is a device that Qualcomm Life makes. It's a 2-net hub. Sending data to the hub is where the 2-net comes from. So the rating just came through, and you might be asking, well, a little bit of a delay between when I actually took my temperature. It's actually based on this device here as to when the radio actually sends the data. So the data went to this device, and then actually I also sent it to my wearable, to my watch. And I have some more examples about that, and you told me not to go on and on about it, so you're going to have to stop me. But there's some really great things here, everything from your thermometers, blood pressure meters, weight scales, glucose meters, and much more.
Excellent.
Yes.
Very exciting. Mm-hmm. And I think we're going to talk more a little bit about the data, so what happens with all the data they capture. But I actually wanted to ask Padma, can you talk a little bit about the healthcare projects that you're working on right now?
Sure. I think one is an interesting one. It's a proof of concept, but really it's meant to illustrate what you can do with a device from a diagnostic perspective, as well as understanding kind of the workings of the device itself. So in fact, a partner and I just presented this at a session last week at Dreamforce. And what we were doing was building a simulated home ventilator system. And the idea was to use that plus a pulse oximeter as two different input sources and connect that to what they had, which was a commercially available IoT platform. And that was the one that was actually gathering the data, doing the correlations, doing any of the complex event processing that needed to take place. There was multi-tenancy in that, meaning that the data would be segregated based on the different types of users who are connecting to the same platform. And then we actually used Salesforce on the back end as our workflow. So, for example, we had, and again, we simulated this on an Android tablet, and I happen to have my Android phone, so I installed the APK on it just to, I don't know if you can really see it, but this is kind of the interface that we used for the ventilator for the simulation. So we had the breathing rate and a couple of different alarms. And the reason why we chose the ventilator was for a couple of different reasons. One was because we wanted to be able to monitor the device itself. So there are some connected ventilators right now, but it's just getting to the point where that's actually happening. So connecting that ventilator, and then the other piece is it had the circuits, so these, the removable tubing. So our use cases were, number one is if you had some kind of battery fluctuation, some voltage fluctuation, to be able to have that be monitored by the IoT platform. And then if there was some kind of issue with it based on the rules that you had, then you'd use Salesforce as the workflow. So you would notify Salesforce. Salesforce would basically contact the manufacturer, set up a work request and get somebody out there to take a look at that. The other one was, again, things that you were replacing, like the circuits, where if you can count the number of times that you remove that on the system, and if you got to a point where you were down to your last one, you could do an automatic reorder of that. And eventually, if you actually correlate it with the readings from the pulse oximeter, if you had made some changes in terms of the breathing rate, but then, again, your saturation levels were changing, based on the rule set, you can either notify family members, notify clinicians, or again, trigger a workflow to get a nurse or somebody out there to actually look at the patient. So this was just, it's kind of the tip of the iceberg in terms of some of the TUNET pieces, as to make it the home health hub. And do you do this for lifestyle? Do you do this for critical care? We even looking at e-commerce, but there's this whole concept of home hubs. There's an entertainment hub that a lot of people, Google and Apple and Amazon are trying to own. And at least we think that probably the health hub is going to be separated at first. Eventually, they probably will combine, but that's at least one of the interesting POCs we're working on.
Thanks. Tim, any projects that you're particularly excited about in remote diagnostics?
Not in remote diagnostic space, but getting back to the e-health issues, we're public health researchers. There's a lot of information out there, and we're going to be talking about data privacy and data use. And right now, it's kind of a free-for-all. We can access data from the Twitter public API stream, and what we're doing now is looking for content associated with prescription drug abuse. And we're applying machine learning, so we code with humans, and then the humans then train the machines on how to code content, and we're able to code 2 million tweets and get a relevant, a pretty good hit rate as far as which ones are relevant to drug abuse. And why this is important is because the way that we do public health and figure out what problems people are having with drug abuse is we send out surveys to high school students. We ask them to answer what was their last drug abuse in the last 3 months or today, and they may not be as forthcoming about that even in an anonymous survey. Here we have a data set that is a self-report, probably more accurate than some of those surveys, and we're able to detect changes and trends in drug abuse very early. So we can detect, are people switching from Adderall to something else, those type of things. So those are the type of areas we're interested in, but I'm also very interested in the research kit that Apple is developing, and we'll talk about that, I think, a little later.
Yeah, so I was going to ask you, since we're on the topic, about data privacy. And looking particularly in the Twitter data, but also a lot of the data that's coming from connected devices, medical devices. What do you think how do we know for sure that this data is not going to be misused in whatever reason? What do you guys think?
Anyone want to go first?
Sure, I can go. So again, what Qualcomm Life's offering is end-to-end solution. You get data from a device and it goes up to the cloud. The data coming from a device is it's already anonymized. There's nothing that is in that data packet that says that it's yours, Daniel, right? So we basically take that packet, encrypt it even more. We've got 7 layers of encryption before it actually gets into the cloud, and then that's when it gets broken apart, and then it gets matched up to the owner of that data. So from getting the actual data up into the cloud, there's no way that you can identify it. It's only after that.
Yes, we're working on a health platform, which had some very interesting policy-based privacy rule sets. And that's for when you don't want the data to be anonymized. Like when it is your data, and you're trying to decide who do I want to share this data with. And it was very interesting because we had a very clever group of engineers working on the algorithms or the rule sets for that, where it was really looking at who do you share it with, all the different people. What pieces of it do you share? And then the last element was the time element, like data from what part of your life do you share, when, with whom? And to really give you that complete granularity to say, I'm feeling fine now, but something happens, and maybe I want to backwards share data with my clinicians for the time that the diagnosis is made and until the cure or whatever resolution is reached. Then after that, I want to remove that again. And so technically, it's actually pretty complex to come up with that kind of rule set and make sure that you've thought through this whole decision tree and you're not, stepping on each other and kind of, reversing some of the rules. So, but I think that's where it's interesting to, it is privacy, but you may not always want it to be private. So you want to have that ability to share and that kind of, flexibility as well.
Excellent. Tim, what does the policy say about, what are different policies, healthcare policies saying about data privacy in healthcare?
Well, I think it's interesting because we want a lot of access to data. we're researchers. We love the fact that, if you can have a robust process to anonymize data and it's de-identified, then we can aggregate it up. Maybe we can say, well, it's not patient identifiable. Of course, some studies, a recent study I think in Science showed that financial data can be, backwards, detected and things like that. So there are a lot of good computer scientists figuring out how to get around this de-identified issue. But for us, the really interesting component is there's a lot of big data out there being collected from a lot of different providers, and if it's properly de-identified, that's a massive data set that can be used to assess whether interventions, whether it's a Fitbit you're wearing, and maybe that relates to some better health behavior, whether you can detect whether it actually improves, health and public health. So from our standpoint, I think some of those privacy issues are kind of aligned, although I will say, interestingly, each platform is kind of different in its own aspect. I will admit I'm a social media researcher. I still can't figure out my Facebook privacy settings. So I think, the algorithms and the logic trees and things like that we may have to revisit that as far as whether consumers really know which information they're sharing and how they're sharing information and how they're opting in. One interesting observation real quickly is on our Twitter study, Twitter allows certain users to block their content unless they allow you to follow them. And we've noticed a lot of drug abusers block their Twitter accounts, so that's one of the unintended consequences of a more robust privacy regime.
Excellent. So I wanted to actually go back a little bit to saving lives with connected devices and talk a little bit about emergency situations that we might have. Actually talk about two use cases. One, it's an emergency situation. Maybe it's a hurricane, maybe it's tornado, maybe it's an earthquake, and you don't necessarily have the network coverage that you usually have, right? What do you do, right? How can you still get the data of the patients? And so that's thing number one. Thing number two, what about countries, the countries where they don't necessarily have all the networks and so on? How do you allow to still get the data of the patients and so on? What are you seeing out there?
Well, that's a good question. That's a hard one. So, I mean, you're talking about the cellular network is down, or power is out?
Yeah,
or?
It might be both, or one of those, right?
Right.
So, what can you do?
Well, real time, it's going to be difficult, right? But you can still use all of these sensors collecting data, and then once you are in range or the power gets back on, it still will. It's a store and forward. It'll still load that data up into the cloud. But it's going to be really device specific. For instance, a glucose meter, will tell the person right then and there what their situation is, and they'll know what to do, what kind of action to take. So
is there like a protocol that says, like, in case there's no network coverage, here's what you're supposed to do on those devices, like on glucose meters or anything?
It's, again, I'm coming from a connectivity place. Maybe you, as a device maker, you can kind of. It's basically dependent on the manufacturer of the device itself.
Right.
Yeah.
Also depending on what kind of connectivity protocol and almost platform that you use, because there are some that have agents that sit on the device itself, as well as a corresponding proxy agent in the cloud. So their whole concept there is that if their connectivity doesn't happen, and this is like if you're updates or anything like that, that those would be stored in the cloud, and when connectivity is restored, then you push that back down to the device. But that's, again, as you were saying, Vicki, it really depends on how did the device manufacturer design their connectivity back to the back end.
So what would be, there are probably people in the audience who are developing devices or looking into developing devices. What would be your recommendation? What are the things they need to keep in mind when they're developing devices for healthcare?
Connectivity one, power. Like how much power does the device actually use? Can you give it different power levels? Can it be in a sleep mode, automatic wake mode? I mean, there's again, a lot of devices are looking into how do you wake up and how do you sleep and when does that happen, and is it still collecting data while it's doing that? I think probably power and connectivity are probably the two biggest issues. And so I think it's interesting is, also the devices are dealing with that. And I think I'm always fascinated by kind of the whole ecosystem of things. And, if you're looking at connectivity, where people are also saying connectivity should be ubiquitous, and you're like that everybody has the right to connectivity as well. So I think it's fascinating when you have devices using these aspects, but the larger scheme is also thinking about like how do you make sure that connectivity is there for everyone, because it's I don't know if you've ever had an internet outage, and you can't do anything. I can't, it's like you can't access your entire life, your money, nothing. And so now if you're going to have health depend on that as well, then it's going to have to be as robust as any of the other kind of metropolitan services that we've been getting.
Super. You guys have anything to add to that?
I'll just add real quickly that we're talking a lot about device design within the context of high-income countries. And one of the things that, as a global health researcher, we focus on is designing devices so that they're appropriate to these developing countries and they can be applied to larger, even possibly more beneficial applications. And one of the things that is really important in that design process is, of course, cost, is, of course, accessibility, no power supply for a lot of these things, and low power consumption, if there is power consumption. So I met Sylvia actually through a friend who's working on some detection devices or tests for counterfeit medicines. And there's a lot of counterfeit medicines in least developing countries. And one of the challenges is you don't have track and trace, you don't have pedigree, things like that. And you have to have a very relatively simple technology in order for consumers to check if their medicine is authentic. One of the things that's going on is something called M-pedigree, where you scan the barcode of the medicine and then it's scanned back and it validates it. But even some people in low-resource countries don't have a smartphone. They only have a feature phone. So a lot of our public health interventions have to focus on what the technology uptake is within that country and then what the appropriate interface is for that intervention. So a little bit on, I'm kind of the oddball in the group, but just to give you another perspective, some dumbed down of design is also something that we're also looking at.
Excellent.
No, I'm good.
Good. So Tim, I actually wanted to ask you, as both as an MD and healthcare research professional, how do you actually define the effectiveness of the medical devices that come to market right now? How can you tell if it's actually helping people and really saving their lives, improving their lives, versus just being a gizmo and a nice gadget?
So, I don't have an MD. I wish I did.
Sorry.
But I have a master's in health policy and law,
right.
So I have a little bit of a legal background. And I have a PhD in global public health, and hopefully that's enough for my wife said no more school. I would say we really don't. I mean, that's a loaded question because we really don't evaluate these devices. It's very consumer-centric. I think the devices that we have, the wearables, a lot of the applications we have are focused on the consumer interface first, and they're not as focused on the evidence base to show that they're actually effective. Now, establishing how they are effective requires, a very structured study, an RCT, a control group, an exposure group, showing whether the intervention is actually effective, maybe compared to a placebo, like not having the device. And there's a journal called the Journal of Medical Internet Research, which is a really good resource for these type of technologies that are being pilot tested. But I will say, our adoption rate is a little bit lower. That's why ResearchKit by Apple is kind of the first segue into this market, where it's really targeting research, trying to make it as the platform for future population-based research, which is really interesting. So I don't think we have good data on how effective a Fitbit is. And to be honest, I'm not sure exactly if we've aligned, the corporate interests of, making sure it's an evidence-based approach to fitness versus the consumer side of it, which is to sell as many devices as possible. That's a gap we have to address. No arguments?
All right.
That was the answer. Can't argue with the doctor. No.
Exactly. Excellent. So let's go. Let's just kind of continue on the theme and talk a little bit about the Apple Health Kit. And so I was, speaking of Apple Watch, which, by the way, how many of you have have Apple Watch?
Wow.
How many of you know somebody who has Apple Watch?
Yeah.
All right. How many of you are going to buy Apple Watch? All right. So, you know what's interesting? I speak around the world. You know, I've spoken over the last year. I've spoken and been to Turkey, Israel, Germany, Colombia, and also a lot of the United States. What's surprising, the consistency of responses about Apple Watch. I don't know what it is, but always like 3 people in the audience. I mean, you know, just at least that's what it's been up until now. But so what's interesting, I read a report recently that says basically quoted the amount of hospitals that work with Apple Watch on research and utilize the data. And how many hospitals do you think work today with Apple?
2%.
3.
3 total.
3 total?
3 total.
That makes sense.
There's one in, I believe, in North Dakota, one in Louisiana, and one at the King's College Hospital in London. So my question is...
Well, Johns Hopkins.
Perhaps.
Yeah, no.
Okay, so maybe 4. So maybe the article that I read was, you know, a little bit outdated. But so anyway, it's 3 or 4, even if it's 5, right? So the question is, do you think that's like totally normal, the way, you know, we're just at the very early stages of adoption? Or do you think things should be much further ahead? And what's holding them up? What's slowing them down?
This is my opinion, by the way. The Apple Watch is not a medical device. It's maybe a fitness, wellness tracker kind of thing. So, and actually, I just read today that they are releasing their Watch OS 2.0 or something that gives third-party developers access to the sensors that are the accelerometers and whatnot. That's actually in the phone. They haven't had that access to date, but. Other people may have a different opinion, but to me, it's you know, a glorified Fitbit in a sense.
All right.
Yeah.
What do you guys think?
I'll go after you.
Okay. I agree. I think right now, as it stands, it is more of a glorified Fitbit. I mean, it's great for lifestyle and wellness, and you know that's why I call like the wearables the gateway devices. I think there's a lot more security, a lot more kind of privacy, a lot more you know features like being able to integrate different devices. Because again, I think the important thing is to be able to get the information from the ear or you know, and what your pill box tells you, and you know, and I don't want a different app for every single one. You know, I want it to actually be one view of my health and fitness, and starting with health and fitness, and then moving more into, you know, if I have to manage my glucose, you know, and then do I press a button for the bolus? You know, I mean, that's a lot further along, I think. But I think, you know, the fact that they're exploring that is good. And I don't have the source on this, but I was reading, and they were saying like the medical technology is probably the slowest to adopt anything, second only to shipping, and sounds about right. And there's a reason, because you're dealing with life and death, and so I think it's okay to be a little bit slower on you know the actual you know true interventions versus just you know tracking kind of how you're feeling and that type of piece.
If I can just kind of, unless you wanted to say
I can come out.
well, I don't want to. You go before me.
Thank you very much. Thank you. I would just say, you know, we're probably going to talk a little bit about this later, but Vicki probably knows better than anybody reimbursement issues. So what's the benefit of the device for a hospital setting? It's really unclear. I mean, I think Apple these are just mediums for data collection, and the software that supports that, or the environment that supports that traps you. Like now, my Mac can only talk with my iPhone. It can't talk with anything else that's a device. The ecosystem that kind of traps you is what they want. They want to get this adoption of an ecosystem within a particular setting and make it appropriate for that particular setting. So the Apple Watch is just another medium. Now, whether it has a high adoption rate in hospitals, again, I really think is something addressed by whether they can license enough content and enough providers and enough apps to bring in that information where it brings a holistic view of that patient and it brings actual outcome data that hospitals want, so that they can seek reimbursement, better reimbursement for comparative effectiveness or whatever other mechanisms that are going to be important for CMS in the future, or if they can figure out some other patient care or quality issue that they can benefit from through that information.
Well, I'd be curious, what are these hospitals using the watch for? I mean, is it the physician? Is it the provider that's wearing it? Are they putting it on I just can't even imagine what the hospital would be using it for. Do you know?
Well, so all I know is that they're part of the research program, so they're collecting the data from the sensors, and there's some program that basically figures out how they're going to utilize this data for hospitals. That's based on what I know. But what I was going to ask you is about where's FDA on all this, and where's do you think that FDA is doing enough to help facilitate the certification and enable new products and new solutions coming to market faster? Or do you think more needs to be done?
I'm going to give this to you. I do have another Apple story, though. I'll tell you.
Okay. All right.
Well, I think the FDA question depends on which stakeholder you're talking to. But if you talk to industry trade groups, they would say that, yeah, the FDA is a little bit slow on the regulation side, and they're not as dynamic. So what generally the FDA tries to do, and in a lot of public health spaces, I think e-cigarettes is probably the best case study, is you get this disruptive device, you have this antiquated regulatory system, and you try to fit it in somewhere here. So an e-cigarette is not a new device. It's either a tobacco product or it's a medical device. It's got to be one of those two, because that's what the regulatory infrastructure we have to deal with this is. M-Health is an interesting space because they were relatively dynamic, but still caused a lot of confusion because, it's very clear from the FDA regulations, in my view, not to everybody, that the stuff that's really not a device, the medical encyclopedias, things like that, that's easy to determine. That's not an M-Health medical, it's an M-Health application that doesn't have to be regulated by the FDA. And those devices or those apps or those things that control a device or change the composition of a body are definitely medical devices. But that middle ground is the part that a lot of people are still getting confused on. And unfortunately, my interpretation of it is we're just going to have to see what those FDA enforcement letters look like before we really figure out what that middle ground is.
Actually, just to expand upon some point that you made, like in terms of the applications, it's interesting there too because again, we're working to say how do you modularize this to make it easier to do FDA certifications or recertifications. So how can you just certify as a regulatory device just the algorithm itself that's doing the prescriptions. So it's doing the correlations, that's doing the event processing, but not the actions themselves. So if you almost think about it like a body, if you think of the platform almost as your body, there's the brain piece that's actually making the decisions and actually saying, yes, this is what you should do, or actually on behalf of you taking some action, like giving you that shot of insulin, for example. But then there's the rest of it that's just carrying out what the brain is saying to do. And so, software-wise, we're trying to structure this as well so that if you had to certify a device, even certify an application, can you just certify a piece of it so that if that changes, you don't have to recertify the entire thing. And I think that would help speed things up. But that really, again, involves a lot of forethought in terms of, how do you architect this? How do you make sure that, the pieces are componentized so that you can kind of pull one out and put the next one in as those algorithms get updated. But it means you have to build it from ground up, which is really hard to do because a lot of people already have built some pieces and or refactor what you've already built, which itself is already a big task.
So case in point to that is Dexcom. How many of you guys are familiar with Dexcom continuous blood glucose monitoring? This is the device that you would actually wear if you're a diabetic. And I'm not, but I wore this for 5 days because I was just curious to see what it was like. It's got a little thread that's in there, and you use a needle, a 26-gauge needle, and actually kind of install it in there. After the first couple of minutes, you just don't even know it's there. And I'm a triathlete, so I swim, I do all that kind of stuff, and it didn't get in the way at all for that. My point being, though, is that the data, there's a transmitter in here that goes from this little guy that you're wearing to this receiver right here that can then take that data and give you the person actionable information on something they should now be doing. Dexcom has recently created an application that you can put on your iPhone. So this has to go through FDA clearance. The app that's on the phone does not, because what it's doing is it's receiving data from this device and just simply displaying it. Well, sure enough, there's now an app that goes on the the watch, the Apple Watch. Again, that app didn't have to go through FDA because this thing is still being used. So that was one thing that is key there, is that you still have to have this as a patient.
Excellent. So at this point, I actually wanted to open up for your questions, and please go ahead and find what you'd like to know.
We're just talking about privacy. You know, besides the FDA, there's the FTC and OCR, and I was thinking about your comment about the architecture of things, and how the FDA is really involved in the device itself, but the things like the apps, for example, might more properly come under FTC or you know, the Federal Trade Commission, and then the whole flow might be under things like HIPAA, which might cover that. So you have to kind of look at what is it that you're measuring and looking at, and then coming up with an appropriate regulatory scheme that applies to it, right? And that's what the architecture thing probably helps.
And what is the question?
It was just more of an observation about that you have different kinds of regulatory platforms that have to be fitted into how a device and the whole ecosystem of the device is going to be implemented.
Yeah, can I think that's really interesting, and it reminds me of what's come out recently with the Volkswagen. that was actually discovered. I think it was a university that was contracted to look at the emissions. It was something that came about just not deliberately. It was like an observation that they made that they ended up following up and realizing that this actually was happening. And it got me to thinking, like with medical devices, I mean, there is, regulation and that you have to get them certified, but especially when you're talking about Internet of Things, where again the decisions, it's a closed loop system, right? And the decisions you're taking the person out of it. How there really isn't anything to really say, getting to the algorithms, looking at the back doors. I mean, I think to really trust a device to, for your life and a closed loop system especially, I think it's going to have to become much more sophisticated. And I think this example just showcased just the tip of the iceberg of what could happen.
All right. Yes, please.
Are there any standards bodies associated with this, especially non-governmental? Please repeat.
So the question was about, are there any standardization or standard setting bodies in the healthcare devices space?
I mean, I could just tell you, just from Qualcomm's perspective, that there are tracks that are through 3GPP and whatnot that are health related. Absolutely. I'm not involved in those, but.
Because that's not going to go back to the device, or is it? And I'm not familiar with those tracks.
Yeah.
Do you know which tracks they are?
I don't. I can find out, though. And then there's also some organizations that are trying to standardize. There was an organization called Continua. It's now got a different name now, that was trying to standardize on basically the format of the data packets. So if you're a glucometer, you're always going to have your data in this format, and et cetera.
Well, it's just a comment rather than a question. It seems to me this is such a broad area.
Absolutely,
it's going to need extensive non-governmental standardization that's international and non-governmental. I mean, because you're going to go all the way from the machine learning device, and this machine learning will provide the security you're asking for. It'll test itself eventually.
I think we're going to take a playbook lesson from the M2M world, where this is already being dealt with in the device network application. So you've got some of the either the T50 groups and stuff like that, but GSMA and others. But I think this is really the holy grail. This is the big problem.
So let me ask Tim. Tim, what are you aware of any standard setting bodies and when it comes to connected health devices?
Not really. I mean, I do a lot of work in global governance, and one of the organizations that works on a lot of communications aspects is the ITU, International Telecommunications Union, which is a UN body. They're working on internet standardization for global internet governance, which is really super hard, you know, this network of networks, things like that. I think there's, of course, the separate discussion of regulatory harmonization, because a lot of these devices are crossing borders. The data packets are crossing borders, and the privacy issues are just immense, like France, for example. I won't get into any more of that. So these type of issues require some harmonization, especially because these devices are communicating trans-border. But the problem is I mean, even as I think one of the interesting things is we're the richest country in the world, yet we have a pretty complex regulatory framework to navigate. There's some opportunities for countries like Afghanistan. We have a study there where, you know, it's a war-torn country. There's a real need for telemedicine. There's a clear need for it because rural communities don't have any access to health, and there's no legal infrastructure for it. So it's a really good place to build out a very innovative regulatory infrastructure in that area, and then use it as an example for other regulatory science making. So I think there's some opportunities that are surprising, and I also think this harmonization issue is not going to go away. ISO, I'm not sure if ISO is one of them. That's one question I had. Maybe ISO has some standards for it. Maybe that's what I could think of. All right. For medical device, I know they have one, so ISO 9001. So, yeah, but I don't know if that would.
Also for there's ISO 13485. Oh, yeah. That's what, you know, just certifying that you can make you know regulated devices, yeah. And so our labs are ISO certified, so that we don't submit ourselves, but the fact that, you know, the software is developed in this lab and then it's submitted through the company that's hired us to create the devices.
All right. Please.
Earlier on, you posed a question about emergency settings, hurricane or tornado or something. And forgive me, but I wasn't particularly excited about the answers that were provided. I was in a situation like that, and I would have given my right arm for a satellite phone. Is there any effort to try to provide backup data transmission connectivity through satellite communication?
Well, I don't know a lot about this, but I do know that Qualcomm was an emergency response team that went out to Haiti, for instance, when they had their issues out there, and they set up these, mini stations and whatnot to provide connectivity and communication. So, again, that would be at kind of a grander scale you're talking about, right? Providing kind of power and electricity and connectivity to an area that's been devastated, type of a thing. As long as, again, if there's some of these devices have cellular modems built into them. This TelCare glucometer has a cell chip in there. If we can at least get the power to get some of the cell towers up, then it can be used that way. But I'm sorry that we don't have a good answer for you, but that's kind of just the way it is. Yeah, it is.
And the other one that just came to mind was like Google was using hot air balloons, to hover above and then provide connectivity. So in an emergency situation, if it was possible to get something like that deployed, and then also solar, which is, I think it's still nascent, but it could be, something that gets developed further along for situations like this. But I agree. I think the problem is there isn't a really good answer. And just to give you another story, my brother lives in LA and he just lost power recently, and he's a doctor, and he's like, I don't have power, I don't have internet connectivity. I had to go buy a regular clock that I put a battery in so that I could wake up. He's an anesthesiologist, so I can wake up and get to the hospital in time. And it's like, okay, it's 2015, and even on a day-to-day basis, I don't think we've solved this. So we certainly have it in a population.
Well, I mean, what was it, 2 years ago that San Diego lost power for 8 hours and everyone was panicked? I mean, how are we going to charge your cell phone? It's just, yeah.
Well, that reminds me that in certain African tribes, there's people make money by charging other people's phone using solar, right? Yeah. So maybe we can implement some of this. But seriously, I think the future that we are moving towards is about ubiquity and redundancy in terms of networks. So you cannot rely on one network by any chance, right? And that's the reason why Google is doing hot air balloons. That's the reason why like Amazon is doing drones and many other things. But there are also a lot of alternative network technologies that come in place. There's a company locally that's just changed its name from OnRamp Wireless to Ingenu that have alternative type of wide area network that's ideal for these type of devices. So there's a lot going on, right? We don't have an answer just yet, but there's some promising developments that are happening in that area. All right, so Sylvia.
I'm going to ask Tim about clinical trials. So uses of these devices in clinical trials, are people starting to do that? I can see like self-reporting in one area for sure. That would, and how is the security issue working with that?
There's actually 299 clinical trials right now going on that are utilizing wearable technology in those clinical trials.
And is it primarily with self-reporting, or what aspects?
It varies. It really varies across the spectrum: indication, patient population, geolocation.
Cool.
There it is. That was easy. I would just say the one company that you mentioned, I forgot the name. It's the blood diagnostic company. Theranos?
Oh, Theranos, yeah.
Yeah, I mean, they launched that. I mean, it's a consumer product now available in Walgreens and things like that, but they really first launched it for clinical trials to get, so that patients could, it would be more easy to do follow-up with them. And then that you could do more constant monitoring because, it's less invasive. So that's a automatic, application of technology into the clinical trial setting where arguably it probably brings a lot of benefit to the patient.
When I know one issue with clinical trial patients is getting them back in, right?
Yeah.
And especially if they live 100 or 200 miles away from the clinic.
Yeah, but it's really interesting. If I could just expand on that a little bit more. There's a divide as far as how these technologies are now removing the subject from research and from the researcher. So the research kit is now going to be piloted by Apple. It's already out there. The idea is that any Apple user can click in and opt into a clinical trial, sign their informed consent, take a survey, a qualitative or quantitative survey, and then some certain data is collected from that device. But the ethical question then becomes is you don't have any personal contact with that individual. You're not even informed consenting them, in person. So does that person really understand the implications of the research? And what they're seeing, at least in these early stage, technology innovations, is that you're losing a lot of people to follow up. They're just doing a clinical trial for the first time or one of these behavioral interventions, and they're just dropping off. And you're really not getting the data you really want because you want to see the long-term impact of that intervention. So there's some things to work out in that space. So that's interesting to look at in the future.
Super. Any other questions? Please.
First, a comment that I want to thank you guys for the advancements you're making. About 12 years ago, I was involved in a pacemaker program. And diagnostically, all we wanted was a diagnostic port right there, so we could check that device. The question is twofold. One is, where do you see designs, or I should say, if you had a wish list of what you could say, where do you like to see the designs of these devices go? Where would you like to see a designer like myself take things, in what direction, and how would you like to see it change? And the second is, and my interest is more in the area of implant as opposed to consumer devices. When we get into the more complex data, like controlling a neuro implant or a cardiological implant, how much advancement is being done in that area?
Wow, that's again a good one. Which one do I answer first? Because there was two. Well, so I know that there are some companies that are looking into actually, getting embedded into the bloodstream to basically look at different proteins to know if you have, there's going to be an onset of a myocardial infarction or something. Basically, there's advance notice, and it can actually communicate through the skin to some device and notify you of such an event coming. So there are some advancements in that area, but very, very new. Obviously kind of a complex type of solution. I don't know, anybody else want to jump in there?
Yeah, I think in terms of, I think probably the one that everybody is familiar with is like the artificial pancreas. right? Like kind of like the holy grail of it. And you know, and we've been working with the two pieces. I mean, we're working with the continuous glucose, you know, monitor, as well as kind of the piece that's actually injecting the glucose. So it's kind of the sensor as well as the glucose injector. And it's, you know, part of it is, I think you showed that one here, where, you know, how do you take that and how do you take the intelligence and not just display it on a phone, but actually have that algorithm and everything built into the phone, in which case it would become a regulated device itself. Makes it tricky, like have to do that. But then to actually combine these two together, and again, in a closed loop manner, to say, I don't need to test for my glucose, and then I don't, you know, I let the algorithm determine when, you know, when and how much insulin that you're injecting into me. And it's being worked on, but there's the machine learning aspect of it as well, which is to say, you know, you have to get enough data to understand for this particular patient, like, you know, how would you predict something? How would you actually measure, and how would you actually adjust? So right now there's kind of, you know, there's settings that you can do, and there's manual settings, and, you know, for like low glucose levels, or again, if you have to inject for bolus or something. But to actually let the machine do that, it's still a ways away in terms of the algorithm and being able to perfect that. But I think, you know, I think it's interesting with the implantables, just the idea of like health records. I'm always fascinated, like, how can you take your health records with you, in you, because then they're actually yours. And we kind of talked about this, about ownership of data, but to actually say, you know, it's not just the person who's collecting it who's owning it. It's not just the person who has the cloud hosting services and is storing it who owns it, but it's a person who's generating it who owns it. And if you're generating it, it almost has to be with you. And so I see kind of that as like one of the most interesting implantable pieces, is more from the data, you know, records perspective.
All right.
So that's an interesting point, because, you know, everybody's trying to work.
Actually, hold on. Do you mind taking the microphone?
Sure. Everybody's trying to work towards interoperability, which has been somewhat of a, you know, it's supposed to happen this year. They put it off another 5 years. Wearable devices collect a lot of data. Now you're introducing more data into the system. What is the feedback that you've gotten from physicians and you know, the IT people at the heads of these medical centers on the formats of data that they want to see and how they want it integrated into their EMR and EHR systems?
Nobody's going to read all of the data that's coming through,
Sure.
right? So it's really more so about having, again, machine learning, have some kind of logic built into the data collection, you know, the back end, that can basically flag when there's an adverse event. So if, you know, Daniel, your blood pressure range is safe between here and here, and you take a reading and it's way out of scope, well, then notify the doctor. Then, so basically it's more about adverse event recording as opposed to every single reading going through the system. In terms of what goes into the EMR, so that's part of it, but then different, you know, providers want different things, but I could imagine getting, you know, summary reports on a monthly basis or a weekly basis, depending on what the condition is of the patient, and having that actually put into the permanent record for the patient.
So I guess with the Healthy Circles platform from Qualcomm,
yep.
You know, obviously you're collecting a lot of data,
Mm-hmm.
and you've integrated with some medical centers already.
Mm-hmm.
Do you actually see the physicians logging into Healthy Circles and reviewing that data with the patient, or are they just reviewing the adverse events or the triggers that are actually sent to them?
Well, it's typically the triage nurses that will actually monitor the adverse events and, you know, basically go through those reports and then take it to that next level.
Okay.
Yeah.
Yeah. So interestingly, from the IoT kind of architecture perspective, it's actually two pieces. Like one where you have your real-time streaming data coming in, and for that you look for patterns, you look for anything that could be interesting to say trigger this, and then what kind of action you do against that. And the other would be what we call the historical data, which is, you know, you would on a batch basis, as a batch job, process that, and that's where you do the data mining, and that's where you, from that is where you're getting the machine learning. And so I think it's, for IoT, it's always a combination of both. Because again, from how we define IoT, it's really that you have more than one data source or sensor, and that you're actually doing some complex event-driven action against it. So, some of it's real-time data, and other is what we call historical or kind of federated data sources that are coming in that provide the context. And the historical data provides the context. So you can say, based on this immediate action plus the context, what am I going to do? And so, yeah, I think probably the triage nurses would be looking at the immediate data, but the doctors and others who are planning out would be looking more at that historical. The trends, right. Yeah.
Yes.
What is the state of the software industry that I would imagine is kind of developing alongside the hardware, where to help people take the diagnostic information and make their own personal decisions about their health in kind of a real-time basis, and I assume maybe different, not necessarily medical decisions, but maybe healthy decisions based on what's going on with your body. You need to eat more of this or less of that, or I want to build up muscle in certain parts of my body. It can tell me, okay, you need to do these kinds of exercises now more. So you're getting that constant feedback, but you're not necessarily using it to send it out to your healthcare provider, but it's you getting advice from the machine about what you actually should be doing for yourself.
Yeah, that's actually what an IoT platform is meant to do. I mean, that's, and so, again, a lot of these wearables and stuff, they may be cloud enabled, it's more of like an M2M, so there's not that, again, that context and that intelligence built into the system to make that decision. But if that cloud platform were IoT enabled, meaning that you do add the streaming capability, some kind of complex event processor, you do have some kind of analytics engine that's behind that to, it doesn't have to be full machine learning, but some kind of analytics engine which takes this historical data and can process it, and then come up with, and then a recommendation engine on the back end to say, based on these and whatever rule sets you've set up as what your parameters are going to be, here's the recommendations that come out of that. That's like your classic, textbook IoT platform. So, and that's it's coming. So again, the POC that we put together, what made it different, the nuance of that is that it's meant to be not just an M2M solution, but an IoT solution to have that decision making behind it. And I think it's coming. It's coming, and I'm not sure how many wearables have that. Maybe some do, but.
Yeah, so there are actually companies out there that are already doing it. So in fact, Qualcomm invested in one of them, and I'll be killed if I get the name wrong, but I'm pretty sure it's WellTalk. So it's a coaching platform. So it does exactly what you were just talking about, where it's going to encourage you to get up and go walking, and if you set goals for yourself, and you get reminders, and so again, it's here. So you might want to take a look into that.
And I was just going to quickly say that there is some controversy when it comes to, providing certain types of diagnostic or even screening devices direct to patient. And this is something that's been going on, especially in the genetic testing space. 23andMe, now Illumina is getting into the space for the commercial and the direct-to-consumer side, where patients get a genetic profile, but not much actionable information. It actually may lead to overutilization of other types of tests. There's a lot of screening devices on the market that you can buy directly, but the sensitivity, specificity of those devices may be suspect. And you have a lot of people that are worried about their health. So I think the component of making sure that the consumer is informed, has some partnership with a healthcare provider for very invasive issues is very important, and we still haven't built that continuity between the consumer side of collecting that information that might be actionable and how you translate to the clinical setting. I think that's still a process that we're going through.
Julie? I'll just pass the microphone.
Okay. So I have a follow-up to that that's related. The idea of the glucose monitor and injector at the same time is really interesting to me, and I'm curious about the more of the social, psychological aspects of it. Is there, so for example, the idea is that you're giving up control to an external governor that's not a person. And so are there predictions about certain demographics will be more open to this type of technology, or what kind of psychological barriers do you think you're going to face in the acceptance of this idea?
Yeah, that's a really great question, because I think it's pervasive to not just this type of system, but anything where we're really getting into the full definition of IoT, which is that this decision is being made by the machine with little or pretty much no human intervention. And so there is, then you start getting into, and we've had discussions at our company with customers and people about, the Minority Report, or, Big Brother, or really like when machines take over the world, and what's going to happen to us. So that's kind of the extreme. And so there is a lot of, I think, fear about that as well in terms of adoption. And probably, as usual, it's probably going to be the people who are, the early adopters in terms of technology, the ones who have the faith in that. But I think even for them, that faith, it will take some time to build up, especially on the medical side. So, and that's what's interesting with the medical versus others, because outside of medical, this technology, it's there. It's actually being used. If you see, like, and again, in the retail and the automotive, even automotive has some security issues as well. But I think in healthcare, because it's so personal, again, because it's life and death, that the adoption for that is going to be a lot longer. And I think that makes sense. And I don't know if you guys have any ideas on that.
No, somewhat similar to that topic, but have you all heard of Proteus? So it's a pill that essentially has electronics in it so that it can be tracked that you actually took the pill and digested it. The uptake has not been, it's been taking some time. So it's interesting. That's an interesting question. Like, how willing are people to let, electronics go through their system, or to control what is actually being distributed in their bodies? That's a great question. It would be an interesting research opportunity.
I'd just say that I think, Pew Internet does a lot of good research on internet uptake, social media uptake, things like that. And there are clear demographic trends towards uptake of certain technology. When it gets to be more invasive, I think that's the question of whether a clinician or some other third party can be a facilitator to inform patients, well, this pill is actually for medication adherence. It doesn't include any component that can harm you. And that's the problem with medication adherence. It's not something you necessarily really want to do per se as well. And even in very simple things. So I have a colleague that's doing a study trying to do asynchronous monitoring of taking your tuberculosis medicine, because if you don't, it leads to antimicrobial resistance, MDR-TB or XDR-TB. And they can't really even get people in rural settings to get on a video chat to do that. It's really hard to just get them to uptake on, going on a video chat instead of having a nursing professional drive all the way 30 miles out there and to get an inpatient view. So I think those social barriers are real issues, and they're obviously most of the time treatment dependent on what type of treatment you're talking about, and they're demographic dependent. I think there's a huge rural and urban divide as well, and there's also the technology divide itself.
A couple months ago, I did see some documentary about the new camera pill for colonoscopies, and so something like that. Obviously, I've never had one, but it doesn't sound very pleasant. So to have a pill and just have it kind of do what it's going to do versus having to go through the procedure. So I think some of those probably, again, would be the way, the leading in terms of, a way to get the technology to do the work and passively.
Well, we're actually running out of time, so I wanted to ask you final question, each of you, and basically, if I have a startup, and my startup is developing connected medical devices, how do I do business with Qualcomm, either with Qualcomm Life or Qualcomm Ventures? How can I interact with UCSD? And how can I work with GlobalLogic?
Just go that way, left or right, whatever. So to work with Qualcomm Life, it's actually pretty easy. What you need to do is just go to the website. There's actually an ecosystem link there. And you just submit a request to become an ecosystem partner. We've got APIs. There's all kinds of different ways to become an ecosystem partner with Qualcomm Life. From the ventures perspective, again, it's more of just kind of reaching out. We've got 2 leads that are involved there, Jack Young and Lucian Iovin. I can't pronounce his last name correctly, but you reach out to them and go from there.
For the UCSD side, it's a little different. We're usually the ones asking for money from somebody, either NIH or sometimes industry, and also, so we're on kind of the back end process. A lot of startups actually originate from UCSD-led principal investigators that are trying to then commercialize their technology through a patent or a technology transfer office, and that's how a lot of startups are actually born. But one thing that's an opportunity is, there's some great people in eHealth. Kevin Patrick is a big name, of course, and they are really trying to move forward with studies and research that can really prove that these interventions are efficacious, that they serve a population, and then that can, of course, support a dossier for a potential FDA approval or even a marketing claim, which is maybe drives the commercialization of a device or a technology more than approval itself. So I think those are the components that are really important to assess when you're looking at UCSD. Is that's where we do the research.
And as far as GlobalLogic goes, we, as I'd mentioned, we do the design as well as the development. And what we're finding, especially with connected products, is that it's really an overlay between or on top of technology plus design plus your business model. And the ones that we see really hitting are firing in all 3 cylinders. If you kind of miss one, you're really missing the kind of market penetration. And so we can help you in terms of helping with the business model. Our method design team does an amazing job of really doing market research, user experience design, user interaction design, and then being able to pick the right technology and being able to help define and create these medical devices.
Thank you very much. I wanted to thank you, Padma, Tim, and Vicki, for coming here tonight and sharing your expertise. Thank you very much, guys. Also, I wanted to thank all of you for coming here tonight. Hope you enjoyed. We're going to have more events coming up. One's going to be in about a month at the end of October. More information is going to be available in our meetup group and on Facebook and so on. I also wanted to thank again our sponsors, without whom we wouldn't have had this event, Molecular Diagnostics and Procopio. Thank you, guys. And finally, I wanted to have, we have a special guest tonight, Tanya Dama, who came from LA. So Tanya runs LA and Orange County Internet of Things meetup that has thousands of followers, and she puts together amazing events on different topics. And I had a chance to speak at some of her events, and if you happen to be in LA or in Orange County and her event is there, it's definitely not to miss. And she came all the way from LA to her event. All right, thank you very much, guys, and have a good night.
The Silent Intelligence.